went to NC State for undergrad. I pretty much changed my major literally every semester the first 2 years. Started with accounting, and then I took an accounting class, and then not so much. Did theater, then I did history education and history, then eventually switched to nutrition. And around that same time is when I took Dr. Ash's Intro to Nutrition course, which I really liked. And then started kind of considering doing dentistry. I went to the dentist, and I was like, oh, this seems like something I could do, and started looking into it more and kind of pursued that, started shadowing. A little before graduating, had a mental breakdown, thought maybe I should be an RD and don't do dentistry, but ended up applying, got into dental school. Thankfully, it all worked out. So yeah, then went to dental school, and basically been working ever since. Graduated in 2015 from dental school, and I had about a semester gap in between because I changed my major so much. It took me an extra semester to graduate, and so then I just kind of worked fast food in between then, make a little money. So I'm a general dentist, so you have to get your undergrad degree, get your bachelor's, and then go through dental school, which is another 4 years. And then I pretty much I didn't complete a residency, but so for dentists in general, it's not exactly the same as medicine. You don't have to do a residency to practice. You can practice general dentistry right out of school, but you could choose to do a 1-year general practice residency. You know, you kind of learn the basics in dental school. A lot of it you get just through practice, but if you want to place implants or do something more complicated, you generally do a general practice residency. Or if you want to specialize, be like a pediatric dentist or an oral surgeon, you have to go into residency for that. And depending on what you do, most of them are about 3 years, but then like oral surgery is 4 to 6 years. So yeah, so it's a lot. So I decided to do general. I like being able to pick and choose too, knowing that I can refer things that I think are out of my comfort zone. But also you get a more variety of patients depending on the specialty. Things like oral surgery or endodontics where you do root canals, you don't get to build that patient relationship as much because they're kind of seeing you for this one specific thing and then they're done. Where I like seeing, continuity of care with patients. So I work in Lane Associates, which is like kind of corporate. They have like 25 practices. I work in a few different practices, but every day I pretty much go to work. We start around 8 or 8:30 for general dentistry, and I see a lot of patients on my side. So for fillings, root canals, crowns, extractions, things like that, and then also do hygiene checks. So do exams on all the patients that have cleanings in your typical day. Pretty basic stuff. Talking to patients about diet is pretty common for me, especially at hygiene appointments. They come in for the cleaning, and particularly if I see like cavities, and depending on where I see them, since sugar is ultimately, the bacteria that feeds off of sugar is the cause of cavities, that diet plays such a huge role in oral health. So I'm really big about educating my patients and trying to get them to understand, what's going on and why and how they can prevent it. So I talk to patients a lot about sugar intake and frequency, and trying, because with oral health, it's more about frequency than amount. So trying to limit frequency and keep sugary drinks, sugary foods to mostly mealtime, so then the mouth has a chance to recover, drinking water in between meals. So that's like a daily conversation I have probably at least 5 times a day. So nutrition is the same conversation all the time, but it actually plays a pretty big role. In dentistry, in school, they obviously teach, what causes cavities, things like that, and we know that, but there's really not nutrition education as a whole. So it was nice to have that compliment from undergrads, like a greater understanding of it all, and I think it just helped me value it that much more. I learned that procrastination is really hard to break. It's probably the biggest lesson. In undergrad, it was fine. You could still, I could study for a test the night before and it would be fine for the most part. But, you get to dental school, instead of 15 hours a week of class, you have 40 hours a week of class. You're in class 8 hours a day. And then you have all night that you have to study. You have at least 1 test a week, and you're already in class 8 hours a day. I lived an hour away, and so didn't have the time. And I wasn't great at preparing. So it was one of those hard lessons to learn, because it's once you get behind because you have so little time in dental school, it's hard to catch up because you don't really have much hours in the day. You only have the evening, and that's pretty much it. And then there's kind of always a test. So like the key is trying to study every night so you're constantly prepared. But then you just go a week or 2 without doing that, and then suddenly you're always preparing for a test because you have at least 1 test every week. So it's just a whole other ball game. So I got a hang of it well enough eventually, but yeah, the procrastination ran deep. I think for me it was actually when I was at state. I volunteered with Nutrition Nuts, and we, being interested in dentistry and going to dental school, created, particularly for Walnuts, where we talked to the parents at Head Start. So I created some education boards specifically about oral health and like children's oral health and knowing how to take care of babies' teeth and stuff like that. And actually ended up being pretty successful. And then I know we had other Head Starts start requesting that we go there specifically because they liked these lessons. I know of it because I graduated in 2010. I know of at least like a year or two ago, somebody I know was interviewing at UNC, and she said she's like, yeah, I went to the school, Head Start, and like we taught about oral health. I'm like, I created that program. They're still doing it. Well, I didn't create the program, but I created the dental lesson. So I was really excited that it's something that kind of stuck beyond me. So I hope it's still being done. I think it's really important to kind of figure out what, at least figure out the general idea of what you want. And I think shadowing can't be underappreciated. For dental school, once I decided to do dentistry, it's kind of just part of the deal. You have to shadow to get into school, which is kind of how I got into it. But it's one of those, I think, even, if you want to be an RD, kind of whatever you want to do, I think there's a lot of value in shadowing and kind of seeing what it actually means to do that and to actually talk to people in that field.